Historically, we assume that women as they age will lose their breast tissue and become less dense. But as we now know, using computer software, that a lot of women will look like this, where their breast density is not changing over time. So we now know that at the age of 60, roughly about 60% of women will still have breasts that look like that. Whereas in the past we assumed this will all be clear and we can see even the tiniest little cancer, which is not really the case. MRI allows us to find the vast majority of these cancers, which you can't find for love or money with mammography, whether it's 2D or 3D.
To get a really good surgical outcome, what we need is to know exactly where the tumour is, how many tumours there are, and what size they are, so we can guide treatment. Now, a small percentage of women, the current imaging that we have is not good enough. And many countries around the world now, including European guidelines, UK guidelines, American guidelines, all suggest that for this small group of women, probably somewhere between 10 and 20% of our patients, we need to do another test. And breast MRI is that test that seems to give us a lot better information to guide treatment and get the most effective outcomes for our patients.
So Mummy's 72, she's a single mother, has been since the age of about 35, with one daughter, myself. She had an ultrasound and a mammogram. I think I was prepared for it, but she wasn't quite ready to hear the news. And so then we went and saw the specialist, the surgeon, and she explained it in more details, that there wasn't enough information and that we needed to do further tests.
So Rosie presented to Breast Queen, where on the mammogram we found this tiny 15mm cancer, and looking at her breast density, we weren't sure how much disease she had, and was suggested that she have an MRI.
Mum was already in shock with the idea of having surgery. But then she was quite taken by the costs involved of having the MRI in particular, and she wasn't at all happy, so she was like, I'm not having this test.
The usual cost is about $600, but in Rosie's case, as you know, because she's a pensioner and she really needed the amount to plan her treatment, we discounted it and she paid a much lower figure. We didn't even break even with that amount.
You paid for it?
Yes. Yeah. Someone had to pay for it.
Now, if you look at this MRI, the cancer on the left side is much larger than what we'd first thought, and it measures nearly 5 centimeters across, much bigger than what we'd thought. And by the way, we also find the second little cancer on the other side, which is about 10 millimeters. So by doing this test, we were able to find the extent of cancer on the left and the new cancer, which was completely unsuspected, on the other side, and saved Rosie a few years.
How is she?
She's staying strong for me, but at the end of the day, it's difficult. Most importantly, it went to the lymph node, which we all know what happens there. So it saved her life, and she's here still today.
I think it is an absolute imperative that we fund MR for breast cancer staging. We need to know exactly how much disease we're dealing with, how far it's spread, and how to manage it.
Well, certainly our Breast Surgical Society represents all 300-odd breast surgeons in this country, and we are unanimous in that we would love to be able to use MRI and have it funded. We do use it, but at the moment patients are having to fund it themselves. The patient group, the Breast Cancer Network Australia, represents 105,000 patient voices, and they're right behind us as well. So there's a pretty big groundswell, and it's really hard to explain to a patient that if she falls over tomorrow, she can get an MRI of her knee at the drop of a hat, and yet here she is with a life-threatening disease that we're hoping to be able to do good surgery on, and she can't have a breast MRI. Now that's a pretty difficult thing to explain to our patients.